Hello, we are Group 3. Welcome to our presentation on gastrointestinal problems, focusing on peptic ulcer disease.
This presentation will encompass the following criteria, which are general overview of gastrointestinal problems, what is peptic ulcer disease, also known as PUD, risk factors, warning signs, assessment and diagnosis, intervention for treatment, and prevention.
Here's a general overview of gastrointestinal problems. The gastrointestinal tract is the organ system responsible for the consumption of food in order to extract nutrients, eliminating the remaining waste as feces. Diseases involving the gastrointestinal tract can range anywhere from the esophagus, stomach, small and large intestine, and rectum. The liver, gallbladder, and pancreas are the accessory organs of digestion. The tract fails to perform its regulatory functions when it is compromised, resulting in conditions such as constipation, hemorrhoids, perianal abscess, colitis, irritable bowel syndrome, and peptic ulcers, of course. It is crucial to maintain a healthy lifestyle and practice good bowel habits, as these will serve as preventable measures to avoid serious chronic gastrointestinal tract illnesses.
What is peptic ulcers disease? Peptic ulcers are open sores that develop on the inside lining of your stomach and the upper portion of your small intestine. Peptic ulcers include gastric ulcers, which are less common and occurs in the lower part of your stomach, and duodenal ulcers, which are most common type of peptic ulcers and occurs in the upper portion of your small intestine.
Peptic ulcers and their risk factors. There are many risk factors that are associated with this disease. H. pylori infection is one of the main causes because when this infection is left untreated, it causes ulceration in the stomach, and this can also progress to cancer later on. H. pylori accounts for 48% of cases of peptic ulcer diseases in America. The overuse of nonsteroidal anti-inflammatory drugs such as Aleve and Advil can cause irritation in the lining of the stomach, which leads to an increased chance of developing ulcers. These drugs account for 24% of the cases of peptic ulcer diseases in America. Old age. Studies have shown that individuals aged 50 and above are at a higher risk of developing peptic ulcer disease. This is because older patients frequently take aspirin and NSAIDs for their cardiovascular diseases and other health issues. This risk significantly increases for individuals over the age of 65 that have arthritis and are also on low doses of aspirin on a regular basis. Some other factors that contribute to the peptic ulcer disease is if the patient has a family history of this disease, overconsumption of alcohol, and smoking.
Peptic ulcers, warning signs. Some of the common warning signs include abdominal pain, poor appetite and nausea, bloating, old age. Old people have a higher chance to get silent ulcers, which means that they will not feel any pain. However, they do sometimes will get gastrointestinal bleeding, which will indicate a sign of peptic ulcers, and they should look into getting it checked out by a doctor. Some of the more rare warning signs include vomiting blood, dark stool, or with blood.
Assessment and diagnosis of peptic ulcer disease. Doctors will usually perform a physical exam by pressing on the stomach to check for bloating, tenderness, and pain. However, since the physical exam doesn't always give conclusive results, they conduct other tests to check if the patient has H. pylori, and this can be done through a set of different tests. The blood test looks for antibodies for H. pylori. For the breath test, patients are required to drink a liquid that contains urea, and if H. pylori is present, it will release abnormally high levels of carbon dioxide. Lastly, the patient's stool is tested for H. pylori stool receptor. Endoscopy is done to look inside one's stomach and small intestine to check for an ulcer. Along with this, doctors may collect a small tissue sample and test it for H. pylori. Barium swallow. Patients are given barium liquid and are placed under a CT scan to detect for any ulceration in the stomach.
Treatment for peptic ulcers depends on the cause. Usually, treatment will involve reducing the use of NSAIDs, if possible, or killing the H. pylori bacterium, if present. To treat peptic ulcers caused by NSAID, one can stop taking NSAID, reduce the amount being administered, or switch to another medicine. To treat this disease caused by H. pylori, different medications can be taken, such as antibiotics, proton pump inhibitors, and antacids, all of which help decrease stomach acid and fight the bacteria. Treatment for peptic ulcers is often successful, leading to ulcer healing. Some helpful tips to prevent or allow healing of ulcers include avoiding foods that irritate your stomach. Stop smoking, as you are more likely to develop duodenal ulcers than non-smokers. Practice moderation with alcohol intake and other drugs such as NSAID. Wash your hands frequently to avoid infection. Regular exercise can also help prevent the occurrence of this disease.